Good afternoon, and thank you for joining us. Today we have Dr. Spencer and Dr. Ramsey here to discuss Onslow Memorial Hospital's CORI Surgical System. While Dr. Spencer and Dr. Ramsey are talking, feel free to ask questions in the chat, and they will answer them at the end of the program. And I'll now hand things off to Dr. Spencer to introduce himself and Dr. Ramsey.
Thank you. So another Facebook Live. So for those of you who don't know me, I am Steve Spencer, the Chief Medical Officer of Onslow Memorial Hospital. Very excited to be here with Dr. Ramsey, who is going to tell us all about the amazing things that he's going to do, and more specifically about the CORI robot. So Onslow is really blessed, I think, in this respect, to be a small community hospital that has 3 robots. So we have Da Vinci, we have a Razor X, and now we have the new CORI robot. And it really puts us in a unique position, I think, in the region in terms of what we're able to offer our patients. And I think, when I came here 11 months ago, I had the pleasure of meeting with Dr. Ramsey, and we immediately talked about the CORI robot and the things we thought it could bring to the community. So I'm glad we're actually able to have this discussion today and start talking about it. So Dr. Ramsey is going to start off with telling us a little bit about himself, sort of, upbringing, what brought you to Jacksonville, and your interest in orthopedics.
Sure. I was born in this hospital, and I grew up in Jacksonville. I'm a Jacksonville Cardinal, and then I went off to school and was always looking forward to coming back. I enjoyed my upbringing in Jacksonville and really liked the community and just the Southeast in general. So we knew when we were looking at jobs, it was a very persistent focus on how do we get back in this region, and we were very lucky that it worked out the way that it did.
Wonderful. Then about orthopedics, the main interest in orthopedics.
Orthopedics is everybody, a lot of different professionals in medicine find their niche and they find what they really enjoy doing, and ortho is just kind of an obvious choice for me. It's fun. I enjoy it. I get a lot of pleasure out of it. I get to integrate patient care and trying to help people get better and improve their lives and their health with a tangible physical aspect of medicine, which is reconstructing bones or joints or fixing fractures. And from day one, I was as a medical student. Some of the first rotations that I was on that was surgical, it was an immediate click that this is where I wanted to go. So it's some of the reason I love it so much is kind of intangible. I don't quite understand why I enjoy it as much as I do, but it was an obvious decision for me.
So tell me about what your life was like in the surgical suite before the CORI, and now I know it hasn't been very long, but after the CORI. What does that look like, and what's the difference?
Sure. So there's a lot of principles about how a knee works. The knee hasn't changed how it works since we have advanced orthopedics. The knee is the same knee that our normal knee is the same knee that we've had as human beings forever. And so some of the principles remain the same because we're reconstructing a knee. What the robotics has changed is some of the data points that we can get and the feedback we get and sort of the live readouts that we are able to take a knee through a range of motion in the operating room and see, are we getting the numbers, the balance that we want to attain? And we have time right there to sort of make adjustments or make some ways to conform the implant so that we have the best outcome possible. And I would say that prior to the CORI, I really enjoyed how I do total knees, and after the CORI, I still enjoy how I do total knees. It's just I have more information with which to make decisions, and so it's really I think about in the world today, we're all seeking, the term some people use would be seeking alpha. We're trying to decrease the number of complications and improve on the margin these little differences. And so we're really seeking, how do we get as close to perfection as possible? And so I think robotics is really going to help us close some of those gaps that we've had a difficulty in closing over the last 20 years.
So does the procedure actually change when you do it, the timing or the actual technique?
Sure, yes, it is a little different. Again, the principles are kind of the same, but what changes is that we now have a readout. We're able to map the knee, and I can essentially, you can kind of think of it as painting the knee, and the computer is mapping on a 3D structure the knee. And so while previously we weren't taking that sort of map and putting it in the computer and then determining where the implants best fit, we were doing that based on standard jigs. Now we get to take that map, and then we also get to take it with a live range of motion that then gives us some feedback on where is the knee tight, where is the knee loose, and then take that data and determine where can we put these implants as optimally as possible. Where might we want to do a little bit of a soft tissue release because you're too tight here or there. So some of that workflow is different. Ultimately, the timing is something that we find becomes pretty much equal. Is some parts of a standard knee replacement that we were doing 15 years ago, we can get rid of with the robot. There's some parts that the robot adds steps, and so the give and take ultimately becomes about a time-neutral knee replacement.
But it sounds like it's so much more fun, like you're doing a video game while you're putting a new knee into a patient.
I see it that way. Yeah.
So what kind of patients are you choosing for the robot? Is that a different type of patient than you would normally choose for the regular procedures?
At this time, I'd say anybody's a candidate for robotics. The one nice thing about the CORI, and they have not yet gotten to this point, but it's coming very soon, and a lot of surgeons are sort of off-label doing even complicated knee revisions with robotics. And right now, Smith & Nephew is working on getting that approved where it's not off-label anymore. But other robotic companies do not have that application where they're able to take even a knee replacement that went bad and then using robotics in order to make sure that we're getting it just right the next time. So that's one nice thing. But ultimately, it's a fun new addition to the hospital, and the staff is enjoying the new addition. And there's not really any patient at this time, aside from technically revision knees, that the robot would apply to.
And what types of procedures are you doing now with the robot?
So total knee replacements, partial knee replacements, and soon to come, we're hoping in the next year, the hip replacement application will come out.
And then you mentioned that there may be differences in outcomes for patients. Can you talk a little bit more about that?
Sure. So what we look for in the knee is we look to make it as normal as possible. We are taking cartilage and bone and replacing it with metal and plastic. And a knee is not a simple hinge, it's actually a complicated sort of rolling hinge. And to replicate that is difficult. And you go to 5 years of training and a year of fellowship in order to learn how to do that sort of thing. But even still, if you get a room full of knee surgeons, we all have our little differences on how do we replicate that? How do we give someone a normal knee? And it's not easy. And a lot of knees don't turn out normal. And I mean, I even counsel my patients now. I say, look, our goals are to get you as normal as possible. Pain control is the primary goal. Even if this solves all of the pain, it doesn't always feel exactly normal. And so with robotics, we're trying to kind of close that gap where we're able to see those little differences on the computer screen or on the readout through an intraoperative exam. It can kind of make the difference of trying to give someone a normal knee.
What about needing to stay in a hospital or rehab? Do we see any differences there?
Robotics has, so this is one of those situations that is kind of hard to say what's the chicken and the egg. I would say that orthopedics has seen a shorter inpatient stay over the last 20 years, and especially in the last 5 years. Even as of last year, the majority of my patients are comfortable going home on the same day. So I don't know that robotics is necessarily going to change that. There are some studies that show shorter stays with robotics, But I would say, regardless of whether it's robots or not, I think that we're seeing some changes in the way that we treat patients pre-operatively, post-operatively, anesthetic improvements that allow for patients to feel pretty comfortable going home sooner than they otherwise would. Some patients stay the night, some patients go home the same day.
And can you tell people about their central experience at Onslow? So I know you guys, even before the CORI robotics, put a lot of work and effort into making that a good experience. We've had conversations about your patients who are surprised when you recommend Onslow as a place where they should get their surgery, because they don't see Onslow as sort of the surgical center and certainly not this orthopedic center. But can you tell us about sort of what the organization has done, what you guys have done to make sure that experience is good for patients?
Since getting here, I have been extremely pleased with how accommodating the hospital has been, the nurses on the floor, the nursing staff in the operating room. The operating room management has really done everything that they can do to kind of help. Together, we're developing systems that lead to fluid patient care. And the patients see that. When they come in, I mean, universally, I have patients come back to my office saying, I had a wonderful experience. The nursing staff was great, I was comfortable, people were nice. It was just a very fluid, kind of hitch-free experience. And I've been very pleased at how accommodating the hospital's been in that sense. And generally anything that I think, hey, we can make an improvement here and there, I have not gotten a lot of pushback. I've gotten, okay, how do we make this happen? And so it's been a great thing to see the teams getting built in the operating room and on the floors, and us coming together and coming up with excellent patient care.
So anything else you want to tell the folks watching about the CORI sort of future state, where you think it's going? Anything else that you wanted to add that we haven't touched on?
Sure. I kind of throw out some credit towards Smith & Nephew. I think there's a lot of robots on the market. There's robots that use CT scans or X-rays to do preoperative templating. CORI is the most advanced robot on the market. It's essentially the way that it templates is on a direct map that you create in the operating room. So we don't need CT scans, we don't need preoperative special X-rays. It's less cost and expense and radiation to the patient. And on top of that, throughout the process of some of the robots that we see that are common, they're a little bit older robots. They take data points in like 2 positions, and we don't really understand what's happening in what we call mid-flexion with some of these robots. And CORI has really come to the table with the most up-to-date advanced robotics. And so I'd say, when I started looking into the system, I actually started looking into this system because I liked the implants that I was using. I think that they're also the best implants on the market. And then I see that in addition, I get sort of the best of both worlds. It's not necessarily a trade-off that, hey, I like their implants, but the robot's okay, or vice versa. I'm really thrilled that the hospital has kind of turned up the game and gotten one of the best, or the best item on the market for the patients of Onslow County.
And I think that's actually a really great point. There are a few robots on the market that are specific for orthopedics. But we did a lot of vetting, you did a lot of vetting, and then I did some vetting after you told me that it was the best. And we really thought that the CORI was really a step above the other robots that you'd see. So every robot is not the same.
Right.
So I think that's a really important point. Are there any questions from Facebook?
Yeah, so we did get one. Someone said that they had hip replacement surgery in June, but now their knee turns in a way that that's a problem that they did not have before. Would this program work for me?
I'd be happy to talk to them about that. There's a number of reasons that people have either what we call an inversion of the femur. There's a number of reasons that someone can have their knee, quote unquote, turning in, And it could be from the hip to the knee to the foot. And so that's something that I can definitely discuss on a clinical visit where I can do an evaluation and get an idea as to why is that happening? Is this something that we can address? What I would say is, ultimately, these surgeries and robotics, knee replacement is for knee arthritis. And so hopefully the patient's knee is not that bad, and maybe we don't even have to talk about doing a knee replacement, but I certainly could take a look and see if there was severe arthritis, is there some way for us to try to improve the patient's symptoms through robotic knee replacement?
Right, and then another question we had earlier was, how does the robot perform the surgery, or would you be performing this surgery, and how that would work?
That's a great question. So robotics means that when we take that map, there is a hand device that basically, one way to look at it would be it forces us to color within the lines, right? So I'm still doing the entirety of the surgery, but I have a device in my hand, and that robot allows me to make perfect cuts across the femur as we plan in the operating room. But I'm still doing it. It's not that we put the patient in a position and then we click a button and we walk out the room. That's not it at all. And there's a lot of the surgery that's not just the bone. There's still a lot that I do in order to try to do minimally invasive exposure of the knee so that we can get to the point that we're even using the robot. There's a lot that goes into a knee replacement, but the robot itself, though it helps me get a perfect cut, I'm still the one cutting the bone.
At 2075, we will push the button.
That's right.
And have the robot
That's right.
come in. But till then, we need the expertise of Dr. Ramsey.
All right.
Any other questions?
Nope, those were all the questions we had.
Well, thank you, Dr. Ramsey. I'm looking forward to hearing more about the CORI. We will certainly be advertising it to the public. We will certainly be talking about the great outcomes that we've gotten from the CORI. And I look forward to the addition of hips. I think all those things are going to be great. And it's really a great addition to Onslow and Onslow Surgical Services. So thank you for being here.
Thank you. Thanks very much.
All right, and thank you for joining us, Dr. Spencer and Dr. Ramsey, and thank you to the viewers for joining us and learning about the CORI Surgical System at Onslow. We hope this program was informative, and we encourage you to visit our website for more information, and have a wonderful day.